This is a lung. A lung is defined as the lower respiratory tract. Where the air passes before it gets into the lung, from the nose to the lung, is defined as the upper respiratory tract. The lung is basically nothing more but air spaces and vascular spaces. The spaces that you see here that are filled with blood, like here, are the vascular spaces, going from a pretty good thick-sized pulmonary artery down to smaller arterial branches, and of course veins, which would have even a thinner wall than the artery. But remember, the pulmonary artery system has a low arterial pressure, so the arteries here aren't quite as thick as you'd expect them to be. When we look at the alveoli, you'll see the smallest level of vascular spaces. You'll see capillaries. The air spaces consist of bronchi, bronchioles, respiratory bronchioles, alveolar ducts, and alveoli, going from the larger to the smaller structures respectively. If you see a airflow structure that has cartilage as part of its wall, like we see here, you can call that a bronchus. If you see an airflow structure that does not have cartilage in its wall, and I bet you will find one pretty soon. Here's a little cartilage, so you have to call that a bronchus. Here you see an airflow structure where there's no cartilage, so you can call that a bronchiole. The difference between a bronchus and a bronchiole is whether there is cartilage in the wall or not. When you get to the very, very, very lowest level of air spaces, such as here, these are alveoli. The majority of the cut section of the lung is nothing but alveoli. If you see an area where there is a common vestibule for groups of alveoli, you can call that an alveolar duct. Mid-portion between an alveolar duct and a bronchiole is a respiratory bronchiole, which are sometimes hard to find, and I don't think I want to waste my time trying to do it. But remember, it is the respiratory bronchiole in which the normally ciliated columnar epithelium then becomes cuboidal before it actually becomes squamous to involve the alveoli and alveolar ducts. So let's review it. Here is a bronchus because it has cartilage. Here is its normal columnar ciliated epithelium. Here is the lamina propria. This fat can be regarded as submucosa. I believe you can call the cartilage as actually being in the adventitia. I don't think you could think of the trachea or bronchi as having an actual media. Here is a bronchiole in which, because you do not see cartilage, and it is also filled or lined by an epithelium which is, like in the bronchus, columnar, pseudostratified, and ciliated. Here are actual alveoli, and here is the wall of an alveolus, and you can see all of these little red things stippled in the alveolar wall are actually capillaries. Otherwise, the wall of the alveolus consists of pneumocytes, both type 1 and type 2, as well as an occasional macrophage. Let's see if we could find some of these pneumocytes. A type 1 pneumocyte is actually a sort of small spindly cell that comprises the wall of the capillary. If you see a pneumocyte that looks a little bit foamy, like perhaps here, almost looking like a mesothelial cell or a histiocyte, you call those type 2 because those are the ones that have surfactant. In addition, You can see cells like here, which are called Clara cells, which also have surfactant in the bronchioles as well. I really don't think there's anything here that we have ignored. Perhaps we could take another quick look at the shotgun and see, is there anything on here that we haven't identified? Well, I guess if you want to look at the very edge of the lung, you would have to remember that this is the the visceral pleura, and ultimately, like all pleural, peritoneal, or pericardial surfaces, they would involve having a single layer of mesothelium. I believe you could probably call that a surface mesothelial cell nucleus, and probably there as well, and probably there as well. So we have a visceral epithelial cell as part of the pleura. We can see alveoli. We can see alveolar ducts into which multiple alveoli empty. If we saw ducts containing clearly cuboidal cells, we call those respiratory bronchioles. I don't think we really found any too easily on this slice here. This could possibly be one because these cells look very, very cuboidal. Otherwise, columnar cells are in the bronchi, in the bronchioles, and the rest of these structures are veins, arteries, and capillaries. And I would probably call this a vein because it has a very thin wall. But remember, the pulmonary arteries also have relatively thin walls because it's a low pressure system. I feel very, very comfortable at saying right now, thank you very much.